Hi, I am Dr. Akshay Chhallani, medical rather and critical care expert at Apollo Hospital, Navi Mumbai. Today I'll just talk about the eICU. What exactly is the eICU and what is the concept of this eICU? eICU stands for Electronic Intensive Care Unit. What exactly we do in eICU? In eICU, basically we monitor the patients remotely. To just give an example, we do a live relay or live telecast of the data of the patient's clinical condition from one place to another. And what is that another place? Another place is a command center at Apollo Hospital, Navi Mumbai. So suppose the patient is there in the interior part of Maharashtra or India who is critically ill, or those patients who are managed in the ICU or in high dependency unit, continuously 24 by 7 on the vital parameters of the patients like pulse, blood pressure, oxygen level are monitored by sitting here. The person or the doctor who is treating the patient there at the bedside will give our inputs depending upon the data what we get from this electronic ICU. So we can suggest, we can modify the patient's treatment by sitting here. This will not only help the treating physician to change the management, but it will change the outcome also, which is favorable for the patient. Sometimes by giving timely input, it is also possible that the patients who are getting shifted to the higher center, that can be prevented or that can be taken care of. So you don't have to shift the patient to the higher center always, because whatever the expert care and the management and advice we can give by knowing the data remotely, it is possible. So most of the times we feel that this transfer to the higher center or tertiary center can be prevented. At the same time, to just give an example, Apollo as a command center, continuously our expert clinical team like nursing staff and the intensivists are sitting here on the console, which will monitor the patient's vital data. So certain change in the parameters will make us to aware that something is going wrong, so that immediately we can pinpoint to the person who is there with the patient to change the management, to take appropriate actions and do the necessary investigation so that the time is not wasted.